CareFlight has been saving lives since 1986, commencing with a single helicopter here in Sydney. Today, CareFlight operates a fleet of helicopters, turboprop aircraft and jets supported by patient transport vehicles right across Australia. CareFlight crews reach, treat and transport patients from some of Australia's most difficult to reach locations. They do it every day, arriving at the scene of traumatic incidents within minutes of being called.
We have specialised teams of critical care doctors, nurses and paramedics who are trained to provide high-level medical care to our patients. We also use the most advanced medical equipment, and when combined with this high level of clinical training, our teams really can provide hospital-level care to wherever the patient is, be that the side of a road in an urban environment or in a clinic in the most remote part of our country. When sick and injured Aussies are overseas and need to come home for medical help, our air ambulance teams with critical care doctor and flight nurse on board are able to provide intensive care treatment to the patients up there in the air and safely bring them home.
Each year, CareFlight trains registrar doctors from the specialties of emergency medicine, anaesthetics and intensive care. However, not only do we train our own doctors, nurses, paramedics and aircrew, but through the medicine program we also train first responders to save the lives of critically injured and ill patients until professional help arrives. Thanks to our generous supporters, we have trained thousands of people in regional and remote areas of Australia to save lives through our medicine program, but at no cost to participants.
With thanks to our supporters, we have been able to invest in the most advanced aeromedical aircraft in Australia. Aircraft like the first aeromedical H145 ensure that we respond to life-threatening situations in the safest and fastest way possible. CareFlight has also introduced a modern, dedicated aeromedical Gulfstream G150 jet. Flying at almost 1,000 kilometres an hour, the G150 can transport patients, loved ones and medical teams non-stop between any of the Australian capital cities.
CareFlight's integrated aeromedical operation means all our pilots, nurses, doctors, engineers and logistics specialists work together to provide vital patient care like no other service in Australia. Using our turboprop aircraft and our long-range medical helicopter, we bring a hospital level of care to people in regional, remote and difficult to access terrain. This level of care contributes to improving access and equity to healthcare for all Territorians.
In the Northern Territory, more than 90% of our patients are Aboriginal people from remote communities. Clinical and cultural safety is key to delivering patient care to the communities we serve. We began our reconciliation journey in 2017. We have worked to build an understanding and respect for First Nations peoples and collaborate with Aboriginal communities and organisations to fulfil our reconciliation objectives.
This continual focus on research and innovation helps us improve the level of care we can provide all Australians. This passion to lead and advance the aeromedical sector is central to who CareFlight is. We're an organisation that never closes. Our 24/7 operations centres are always there to ensure that we can get care to our patients when they need it. To deliver our social purpose, we rely on the generosity of our supporters, and I can't overstate the importance of this to ensure that CareFlight can continue flying. Every donation, grant, sponsorship and bare purchase helps us to fund our vital services right across Australia. We've come a long way from our beginnings, but one thing hasn't changed, and that's our mission: to save lives, speed recovery and serve the community.